Hello, today we're going to talk about Chapter 3, the Changing Healthcare and Public Healthcare Systems. Our objectives are going to describe the events and trends that influence the status of our healthcare system, discuss the key aspects, compare the public health system to primary care, and explain the model of primary health prevention. We're going to talk about assess the effects of healthcare and insurance reform, and evaluate the changes needed to public health and primary care to have an integrated health delivery system. So forces stimulating care and demand of healthcare are demographic trends, social, economic trends, the health of the workforce trends, and technology trends. Demographic trends, we have baby boomers. Our rise in foreign-born populations are also very much part of our demographic trends. Social economic trends can be things as changes in lifestyle, a growing appreciation of quality of life, health seen as an irreplaceable commodity, changing composition of families, changing household incomes, growing gap between richest and poorest, revised definition of quality health, and a rise in contemporary and alternative therapies. A healthy workforce trends means we need to do something about our nursing shortage. We have particularly low levels of nurses, especially minority nurses, periodic shortage in primary care providers, and we have a growing number of nurse practitioners to help address these trends in public health. Technology trends, we have telehealth, we have EHR, we have benefits of 24-hour availability now, increase in care coordination and quality of care, improved quality measures and monitoring, and reduced medical errors. Our drawbacks are privacy, security concerns. We have some inconsistent quality of online resources, and we do tend to have very expensive equipment that requires higher levels of training. Telehealth is the use of electronic communication networks to transport patient-related information. So causes for disparities in the U.S. healthcare systems. Number 1 is cost, number 2 is access, and number 3 is quality. We just don't get the quality care we should for the money that we pay for health care. The cost, it is really getting more and more expensive to be healthy or to get health care or to pay for health care. Access, there's been a rise in uninsured people to 48 million in 2012. We did reduce that, but there is some talk that since there are new changes in the Affordable Care Act that we will probably see a decrease in that an increase in that 48 million. We definitely have coverage, access to healthcare services. It's very difficult, and sometimes the biggest thing to do is to be in a healthcare coverage with groups. Sometimes though the groups are poor, working, or non-working, minority group members, or non-English speakers, including illegal immigrants. Those groups usually don't get insurance, and they usually cause a lot of high cost in insurance and healthcare delivery because they don't have any way to pay. Quality. To err is human, building a safer health system. This report identified that 98,000 deaths a year were attributed to preventable medical errors. Beyond the cost in human lives, preventable medical errors result in a total cost of $17 billion and $29 billion per year in hospitals nationwide. Preventable medication errors alone represent more than 7,000 deaths annually, with a cost of about $2 billion nationally. Keeping the patient safe, transforming the work environment was an IOM report in 2003. It stated that nurses' long work hours pose a serious threat to patient safety because fatigue slows reaction time, zaps energy, and diminishes attention. It called for the state of regulators to pass laws barring nurses from working more than 12 hours a day and 16 hours a week, even if by choice, And then we want to cultivate a culture of safety. We want to report sentinel events. We want to have our hospital compared to other hospitals, and we want public health accreditation. The process of public health is new, and the impact of quality and safety monitoring has not yet been determined, but we need to see what's going on with our public health. Organizations of healthcare systems, we have a primary healthcare system, public health system, the federal system, the state system, and the local system. All have different working mechanisms, but all have the same goal: healthy patients, healthy lives. We want healthy patients. Primary care is accessed in the United States through insurance. It's managed care. You can have network, gatekeeper, HMOs, PPOs, Medicare, and Medicaid. Public health systems, national, state, or local laws, mandates. It has multi-level federal, state, and local systems. It's interdependent. It has local health departments provide care that is mandated by state and federal regulations. Federal system is like the Department of Health and Human Services, our Office of Global Health Affairs, our U.S. Public Health Service, our Health Resources and Services, our National Institute of Health, our FDA, CDC, Centers for Medicine and Medicaid Services, and Department of Homeland Security. They all address public health concerns. Our state systems are like disaster prevention, healthcare financing, mental health and professional education, health codes and licensure, insurance regulations, direct assistance to local health departments, and Board of Examiners for nurses. Nurses serve in many capacities in state health departments. They are consultants, direct service providers, researchers, teachers, and supervisors. They also participate in program development, planning, and the evaluation of health programs. So local systems are directly responsible for citizens of its communities or jurisdictions. Services vary depending on the following: health codes, community needs, fundings, and resources. So forces influencing our care systems, today's challenges are high cost, uneven quality, and access to care. Access dependent on ability to pay. And health care is big business, so it can be pricey. Factors to decide as a nation: what must we do for all? Who will be in charge? Who will pay for it? So we got some questions we got to get answered. Integration of public health and primary care systems. Historically, they've been separate systems. The Institute of Medicine Committee formed to examine the integration of the systems. Clear definitions were used to guide the integration. The purpose of the integration, the World Health Organization goal of primary health care. So primary care is the providing of integrated, accessible health care by services, clinicians who are accountable for addressing a large majority of personal health care needs while developing partnerships with patients and practicing in the context of the family and the community. The IOM said public health is fulfilling society's interest in assuming conditions in which people can be healthy. So we definitely have some definitions of what is public health and what is primary care. Potential barriers for integration was different roles and functions. Primary care is people-focused. Public health is community-focused. We have two different foci, so functions can be different. Different funding models. Primary care is generally funded by individual client payments and health insurance, where public health is funded by tax dollars, federal, state, and local grants. Which represents the funding of primary health care? Is it health insurance, federal funding, state grants, tax dollars? And the answer is A, health insurance. Get that. Health insurance or individual client payments represent funding of primary care. Public health is paid through tax dollars and or federal, local, or state grants. So primary health care is the goal of integration of public health and primary care. So we've had a lot of primary health care systems starting in 1977 and different kind of mission statements here. Primary health care is highly political, and in each UN nation interprets goals based on its own culture, resources, needs, and type of government. Most nations have not achieved their public health goals. Healthy People 2020 objectives, we have many different objectives. And we want to attain those goals because we have quality, we want to attain high quality and longer lives, achieve health equality, create healthy environments, and promote a healthy quality of life. Those are some overall objectives. And the healthcare delivery reform efforts in the United States have been, we've had Healthcare American Nurses Association in 2005. We tried to find balance between expensive, high-tech, and community-based prevention. And then we had the Affordable Care Act, which was instituted in 2010. We're still working on how to balance our health care and public health needs, and we shall see where it all goes in the future. Thank you. That is Chapter 3.